depressed, one of the things that tends to happen is they have distorted thinking. So they may have this sort of all or nothing thinking. Either my life is perfect or my life is terrible. For most of us, it's something in between. They might maximize the negatives and minimize the positives. They may have something that psychologists call selective abstraction, and that means when we look for things to kind of confirm our view of something. So if I'm convinced that that you won't like me, then I take the fact that you're wearing the color blue and I hate the color blue as an indication that you don't like me. That's not necessarily there, but I'm confirming what I already believe. That also leads on to things like self-fulfilling prophecies. We act in such a way, so we often bring about the outcome that we expect, and if this outcome is negative, that's what we get. When someone's going through depression, they can face a wide variety of symptoms. For some people, they sleep too much. For others, they sleep very little or have broken sleep. Eating changes, again, can be two ends of the spectrum. It may eat to comfort oneself, or someone might completely lose their appetite. Lethargy, feeling really tired. And we're talking tired to the point of, things that you would do without thinking, like taking a shower, all of a sudden become really difficult to do. One of the things that I find interesting about depression is we always use that word, don't we? Oh, I'm depressed, I'm having a bad day. Real depression is about hopelessness and helplessness and just feeling that perhaps you can't see a way out. And those feelings, feeling very much of the here and now, but also the sense that they extend into the future. You may feel very alone. All of these symptoms can be attributed to depression. People can overcome depression through a variety of means. For some people, it's social support, getting that kind of, whether it's through friends and family, being able to talk about it. For others, it's by getting therapy, seeing a counselor or a psychologist. For others, it's through antidepressant medication that allows basically the brain's chemicals to be balanced, because so many times what we're feeling has a lot to do with how our brain is functioning. And for others, it's a combination of all three, which a lot of studies show usually has the best outcome. If you recognize that you're depressed, I think the first thing to do is to share your problem. Now, this might seem easier said than done. We live in a society where everything but perfection seems to be taboo, from the way that we look to the way that we behave. Reality is, a huge proportion of the society in the UK and across the world are depressed. There's nothing to be ashamed of. We all get flus, we all get colds. In fact, depression is often called the common cold of psychology. The reason for that is because we live in very stressful times. So the point is that you need to try and help yourself get out of it. And if it's something that you can't do on your own, then asking for help is a huge part of coping. Sometimes coping is saying I can't cope and I need help.